Thank you for being with us again. In this class, we will be talking about prevention. Diabetes can cause problems, but you can prevent them. We want to help you make healthy choices every day and learn to recognize warning signs so you can act in time and stay healthy. Thank you for being with us again. In this class, we will be talking about prevention. Diabetes can cause problems, but you can prevent them. We want to help you make healthy choices every day and learn to recognize warning signs so you can act in time and stay healthy. Consider this case. A man with diabetes comes to the clinic to ask for Viagra. He tells the doctor that he is having problems with his wife, but he is too embarrassed to talk to her. He also admits that he does not always take his medications. Because of this, his wife believes he is being unfaithful and wants to leave him. The man requests the medication in an attempt to fix the problem. His doctor discovers that the man's diabetes, or A1C, has not been well controlled. The doctor explains that when blood sugar levels are high, sugar damages the arteries. The higher the blood sugar and the longer it stays elevated, the more damage is caused. This man has what is called erectile dysfunction, caused by diabetes as well as high blood pressure and high cholesterol. He was not aware of this because he had not seen a doctor in a long time. But what do you think the real problem is? The real problem is communication. The man did not talk to his wife about his sexual problems related to diabetes. He avoided the topic, and she thought he was being unfaithful. Now she wants to separate. The other problem is that he has not been taking his medications to manage his diabetes or going to the doctor to check for high blood pressure and high cholesterol, all of which affect the arteries. Ask yourself, what could you do differently? How can you improve communication with both your spouse and with your doctor? Your body is connected by veins and arteries. High blood sugar, cholesterol, and blood pressure can damage them. This can cause numbness in your hands and feet, and it can also affect sexual organs, both in men and women. The more of these conditions you have, the higher your risk. So take care of your body now to prevent damage. Healthy choices help both you and your loved ones. Having diabetes or being at risk for it also exposes you to other problems. High blood sugar can damage the arteries, and the same is true for cholesterol. People with diabetes over 40 may need medication for cholesterol. People at risk may also need it, depending on their levels. Diabetes can also damage the kidneys. This can lead to serious kidney problems. People with diabetes should have a urine test to check for protein at least once a year. Ask your doctor if you need a urine test or cholesterol medication to protect your heart and kidneys. People with diabetes or at risk for it are also at risk for high blood pressure. Do you know your blood pressure level? The goal for people with diabetes is to have blood pressure below 140/90. Controlling blood pressure helps protect your arteries and reduces the chances of complications. Just as taking care of our body is important, taking care of our marriage, especially when it comes to communication, is also very important. Do you remember that patient who had problems with his wife? If he had maintained good communication with her and shared his physical health issues, they could have avoided the conflict and potential separation. Communication is important for both partners in a relationship. It is something we rarely talk about with anyone, whether at the clinic or even at church. Sex and intimacy, especially in marriage, were designed by God. Ironically, sex is present in every television ad and throughout our culture in an unhealthy way, to the point that we sometimes forget that it is a wonder and a gift that God gave to a husband and wife when they were married. It is important to talk with your partner. Healthy relationships contribute to your overall health. Mental and emotional health are part of physical health and can affect diabetes and its complications. Reconnect with your partner like you did when you first met. Go on small dates together, even if it is just a walk, to start rebuilding communication. It is never too late to start over and improve your relationship. What would you say to this man? Some options could be communicate with his wife and involve her in his medical care. Understand why he is not taking his medications and talk about those issues. Schedule an appointment with his doctor if his diabetes, or another condition, is not well controlled, usually every 1 to 3 months. Or have other tests done, such as blood pressure, urine, and cholesterol. So, let's talk about your goals. How have you been feeling? What goals have you set and achieved? Have our tips been helpful to you? We want to hear from you. You can talk with your community health worker, call us, send us a text, or use whichever method is easiest for you. If another time of day works better for you, let us know. We want to help you in the way that works best for you. Do you need help getting your medications? We are not only talking about diabetes medications, all of your medications are important. If you are not taking your medications because of cost, missed appointments, side effects, or other reasons, your community health worker can help connect you with medical care. Thank you for listening, and we hope you will join us to watch our next video. Until next time.